Well, welcome, welcome, welcome. We just are so excited to get this conversation started. I know, Dr. Hines, you said you have your own music. I didn't know that. Okay,
Play a little something to get us all in the mood here. I love
that
a little
sounds
mood in the day,
wonderful. Yes.
but we're running a little behind. I don't want you to have. All right, I'll do a little. And I'll be down now. Anytime you call me, I'll be down. All right, I'm down. She's down. We're all down. Perfect. All right. Yes, people. I am Dr. Hines. Please take a moment. We're going to be using chat function today a lot. So take a moment to write where you're from and what do you hope to gain today? And maybe one word to describe your mood. I know this is post lunch, so we got to keep it up to keep you excited. So by all means, we got Columbus, Ohio in the house. Hi, Tamika. We got Seattle. Hello, hello, hello.
We had a couple of people from London. Yeah, at the last, I think she's here. I think we have our UK friends, at least one. So we're officially international now.
Beautiful. And we can't see our guests, but Rakaya and I will be looking at the chat function for participation, right? So let us know whenever you want us to start. Do you want us to give it one more minute?
We can get started, Doctor. And do you want me to make introductions or you'll make introductions on your
Okay.
own?
We'll
I know
definitely make our
you're
introductions.
so fiercely independent. So I am not.
Blessings. And call me Heather, girlfriend. What's up?
I tell people, girl, my roommate in undergrad, when I was out, she was studying to become a physician. I give honor to your titles. No, ma'am. And she's seen me
Okay.
naked and I still call her doctor, whatever. So,
Right.
so we're going to stay naked. We're going to stay doctors. But I'm so excited to have these wonderful, last year, your session, their session, people literally hung up and said, we want them back. And so we are so grateful that you're back. I will let Dr. Finlander Hines and then the wonderful Rakia introduce themselves, share the work that they're doing. And I won't take any more time because I know there's a lot we want to discuss.
So thank you so much. All right. So support during birth and beyond the partners edition. Welcome. I am Dr. Heather Finletter Hines. I'm happy to be here with you today to focus on connecting families to support available in the community. We understand that much of the focus today is on the birthing person, postpartum person, and the baby, and we wanted to recognize partners and support people because they are important.
Very important. Hello, everyone. I am Rakaya, and very happy to be with you here today. Heather and I together have over 30 years of midwifery experience, if you can believe that. And we have witnessed partners being extremely supportive during this time and not so supportive. And we wanted to take some time today to help prepare partners to support birthing people, not only during birth, but during pregnancy, preconception, and through the postpartum period.
Beautiful. Thank you. And I'd like to give a shout out to Elizabeth Sullivan from Long Island. Where is Long Island again? Is that in New York? Beautiful. Scully, nice to have you here. Moving on here. Wonderful. All right, so today we're going to use the chat function. We're going to take moments where we want you, I'm assuming that you guys can't unmic, but we want you to use the chat function to give us the add-ons to this presentation because it takes a community to support birthing people, and the chat boxes is what's going to bring us together as a community so that we can take what we learn out and really be able to support our communities.
Here's our agenda for today. So I love an agenda and
She loves an agenda.
I do. Objectives, anything that will help guide our time together. And today we plan on starting at the beginning, literally, preconception through pregnancy, labor, and the postpartum period, with special attention on what it means to receive your care in a hospital and also in the community setting, focusing not only on the birthing person, but the support person or partner. And before we start, please call us in. Our goal is always inclusive language, but we may refer to mother and breastfeeding rather than birthing person or chest feeding, just because these are the terms that we are used to using. So call us in, but our goal is to use the most inclusive language.
So I just want to take a moment and to shout out my co-speaker with me. With her support, we're able to do these talks because we just flow together really synchronously. So as I said, my name is Dr. Heather Finletter Hines. I've been a midwife for nearly 25 years with an experience that builds on community. My passion has always been growing families, educating future midwives, and advocating for compassionate, equitable reproductive health care. As the owner to One Love Midwifery, hashtag follow me on Instagram, One Love Midwifery, I'm honored to bring personalized, heart-centered midwifery care to the communities that I serve here in Eastern Long Island.
And once again, I'm Rakaya, very grateful to be here with my partner in crime, Heather, and I am a full scope practicing midwife since 2011, so for a little bit of time here, and the current division director of the Stony Brook Midwives here in Long Island. My midwifery practice is focused on listening and seeing patients as whole people, and also providing that same equitable and inclusive care that Heather mentioned, addressing disparities in healthcare, specifically the morbidity and mortality that is associated with giving birth as a Black or brown person. I'd like to say that birth is what drew me to midwifery in the beginning, but the longer I practice as a midwife, the more it becomes clear to me that I'm really here for the woman, the birthing person, and to help hold the mama.
Nice, thank you. So we're going to divide this up into acts, right? Like when you go places, you go to a restaurant, they give you food in different sections. We want you to digest each part of these in little segments that will bring it all together as a whole in the end. So the first act is preconception. Rakaya?
Yes. So preconception, ideally, this is where we can begin to build the trusting relationship as provider and patient and provider and partner or support person. Um, Pre-pregnancy care, the goal of it is to reduce the risk of adverse health effects for women and birthing people, for the fetus and the neonate, by working with the birthing person to help optimize their health, to help address any modifiable risk factors, and provide education about what a healthy pregnancy would look like. So we can address those potential risks, optimize health, and improve outcomes. And it's so important for partners to be included in this part of the journey. So we like to call, for the purpose of our presentation, we like to call this period the planning phase. We understand that many pregnancies may happen unexpectedly, but if you have the privilege to plan for a pregnancy, then it's something that should be done together as a unit. Typical recommendations for the patient during this period that the partner can also engage in have to do with the avoidance of toxic habits, with movement, with weight loss if necessary, with healthy eating, with a focus on nutrition and what we put into our bodies, and with mental health support.
So the first thing that we're going to talk about is toxic habits. And I always crack the joke, if I have to give it up, you have to give it up also, right? So as you look in at these pictures, which are just random pictures, we have marijuana, we have alcoholic beverages, and then the side joke is, skydiving. There are toxic habits that we need to encourage women. Maeve, I see your shout out. We apologize once again if this triggers you. We're going to use sometimes birthing person. We're going to use women. We're going to use, pronouns depending on what our clientele brings us to. But when we think about toxic habits, a lot of people are like, I drink raw milk. I eat, unpasteurized cheese. I eat sushi throughout my pregnancy, or I'm eating it now and I plan to eat it through my pregnancy. We need to be able to have our patients centered on things that can cause issues during the preconception, pregnancy, and postpartum time period that could cause effect to them and or their fetus, right? So if people are smoking and they're smoking marijuana, that could be laced with something else, it could be by themselves. There is traditional medicine that says marijuana is okay for some people. There's literature that says it's not. if we go to the American College of Obstetrics and Gynecology and the American College of Nurse Midwives, smoking, ingestion of marijuana, alcohol can cause issues to a growing fetus. So we want to encourage patients to, in that preconception time, to decrease the amount and to stop if they can, so that they can have a healthy pregnancy period without any issues. When we think about alcohol, we have to think about fetal alcohol syndrome. And in their research, was it the one drink, two drink, or was it the fifth drink that caused the fetal alcohol syndrome? That information could not be derived from the testing that they did. So we want to encourage people during that preconception time to avoid these things and pick up healthy habits. Get moving, right? Like, I literally remember being in midwifery now for so long that, 25 years ago, people were instructed to stop moving. Exercise is bad. You're supposed to sit. And I think people were smoking Luckies. Like, women were smoking during their pregnancies earlier. Well, that has all changed now. We're asking people to stay active. If you were active during your, planning phase, your preconception, the beginning of pregnancy, research has shown that exercise relieves positive endorphins, and that helps people to overall feel better. It helps them to move. It decreases the aches and pains or the common complaints of pregnancy. So we want to encourage our birthing people, moms, to move. Physical activity and exercise in pregnancy is associated with a minimal risk and has been shown to be a benefit for most women birthing people. And although some modifications need to be integrated, right? Like, if you have someone that's doing kettlebell swings, they might need to bring it out to the side more so they don't hit their belly. Or if they're doing, CrossFit, they might need to do a snatch a little bit differently. Or if they're doing yoga, they might not need to twist inwards. Modifications might be needed. It's important to encourage them to continue moving, because it will overall give them a better pregnancy satisfaction scale.
Now, for weight, one of those things that Heather and I don't really love to talk about, but we do think it's important to just mention that for a healthy pregnancy, pre-pregnancy weight, which is a BMI between 18 and 25 or 24.9, the recommended weight gain during pregnancy is about 25 to 35 pounds. And this goes down with those who are starting pregnancy at a higher weight. This generally translates to about 2 to 4 pounds in the first trimester, and then a pound per week for the remainder of pregnancy. This is a general recommendation, which is important to remember, and there are many factors that influence weight gain during pregnancy. In terms of appetite, were you nauseous at the beginning? Were you having a difficult time eating? Did you not have much of an appetite? You can imagine that first trimester weight gain might be a little bit less. So we love this image here because it shows you where some of that weight is going during pregnancy. And one of the things that we remember or want to include is the partner here. So to be mindful of how you are moving your body and the things that you are putting into your body so that you can really engage in community with that person who would be carrying the baby.
So here's my question to you using the chat function. What are your thoughts about BMI? When you hear the word BMI as a person sitting here today, does it bring up any triggers? If you were supporting someone in a pregnancy and maybe they were, I'm going to call fluffy because I like fluffy, fluffier than the next person, how would you help them to decrease their triggers? Thanks, Toby. It's definitely a trigger, right? Like, has anyone gone to an office and the scale is out in the hallway? Good night. My scale is in the bathroom and I only go on in the dark at 5 o'clock in the morning. All right. So yes. Dominique said many triggers. Fat phobia in pregnancy is real, right? Like, I was just on Facebook looking in some mothers groups because that's where I scope out all the information of all the hot items and things going on. And people were talking about this one provider who is awesome in the hospital, but the office care is awful because literally they have to sign a piece of paper, which I didn't even think was legal, that they won't gain 10 pounds in a pregnancy. I'm like, I would be like, goodbye, see you later, right? So how can we help our significants in being able to manifest a good, happy pregnancy if they're triggered to go in the office and have to be put on a scale?
That's right. Bone structure needs to be accounted for. Yes, thank you. And Heather, you love to tell this. You want to tell the people where BMI came from?
So BMI, honestly, and I'm going to say sorry, not sorry, is for middle-aged white men, and the scale was made for them. It was definitely not made for the robust Caribbean woman or the African woman or our ladies of today. It was not. So we cannot tell people that their BMI is such because the scale was not made for us. And I think what midwives do is we ask patients, is this a weight that you feel comfortable at? Right? We all know what weight we feel comfortable at. Most of us have clothes from one spectrum to a puffy spectrum, right? I'm feeling thin this day and I'm having a puffy face. So I think we need to gear our conversations about weight being sensitive, but we should equip people with tools so that they are able to advocate for themselves when you go to an office and the first thing they want to do before asking you how you're feeling is weigh you. You want to incorporate something that gives them the power and takes away that energy.
Yes, and body types, level of fitness, you are correct. BMI does not accurately measure muscle, and it's not an accurate measurement of health. As Heather mentioned, it was developed by white men really to be used for as being part of an insurance company and being used for underwriting purposes. So not for women, not for pregnant people, for sure.
Right.
And we want that partner to be supportive and confidence for the person who's carrying the pregnancy, to remind them that the scale is a number and the BMI is a number, but that is not an accurate measure of how healthy a person is.
Right. And one of the things that I always crack a joke is I was like, before you were born, you were eating for two, meaning like in the 1970s, 1980s, we were like, you're eating for two. Nowadays, we're eating for one, and you want to eat for a healthy one. So you just crack a little joke, make your patients comfortable or your partner comfortable, and be like, if we're going to have a cookie, let's wrap it in protein. I always tell people, like, put protein with everything, and it'll make it much better. Okay? Cool beans. Moving on. Thank you for those that are hitting the chat box. All right. Choosing your provider. This is same as preconception, plus more, right? This is active. Okay. So
So
go ahead.
you might be wondering, how do you choose a provider? Are you going to Google? Are you going to Yelp? Are you going to ZocDoc? Because that is on trend right now. Do you stay with the provider who did your PAP when you were 16 years old and that's all you know, or who your mother or your sister sees? What about proximity to home, or when they can accommodate an appointment for you? Um, they're all things that you might want to consider, but we want to make sure that as you look for a provider, that you talk to people. Word of mouth and referral is the best way to find a provider. And we want to encourage you to shop around, right? If you have a provider who maybe served your needs well for GYN care, meaning your pap smear and your routine stuff, and now as you're preparing for pregnancy, you're looking for something else, please be encouraged to find another provider. It's okay. We know breaking up is hard to do, but you want to be mindful that as your needs change and your goals change, maybe the type of provider that you need changes. And we might be a little bit biased, but we think midwives are wonderful providers for your needs related to preconception, during the pregnancy, labor, birth, postpartum, and also for those routine visits that maybe you were seeing someone else about because you didn't know about midwives.
Right. And I'm asking a question. Once again, grab your chat box. Um, would you, as a support person, support your mom with changing her provider at 36 weeks? Right? Like if you're feeling that hair on the back of your neck stand up every time you go to the office, would you have that honest, safe conversation that says we need to find a provider that truly sees us? And I always get on my soapbox about this because people sometimes get stuck and comfortable. And it's so funny that we will take our drink back to our coffee shop if they didn't get our latte portion of milk right, but we will stay in an office where the provider discredits you and puts you down just because you're feeling comfortable. You need to understand, and I put this out so you can tell the next person, your insurance is money. You Just by giving that card, you dropped $1,000 bill in a second. If you go to an office and they are not meeting your needs from the door to the exit, right? Then you need to go someplace else and take your money with you. Don't stay someplace and be uncomfortable just because of convenience. You want to be seen by a provider that ultimately might save your life because they intricately know you and know what you need to be successful. So in the chat, people like, yes, your birth, your way. Absolutely. Currently working with a client who is changing at 26 weeks. Absolutely. You honestly don't want to try to change if the baby is crowning, like you kind of want to catch someone before that. But people have the option to even go shop around. If you're in a practice and something's not right, maybe go to another practice and interview them and see if they align with your soul. I think the soul is the best part. Your body will follow. I think it's aligned with your soul. Beautiful.
Yes, Dominique, absolutely changing providers is sometimes necessary for a happy and healthy birth. And Ashley, thank you for your honesty. Currently working with a client on changing at 26 weeks. It can be scary for the birthing person, but very empowering. Still learning the proper language to assist and guide on this as a doula. And honestly, one of the things that I like to say is when people show you who they are, believe them, right? So if at 26 weeks your client is feeling not the things that Heather just mentioned, but that they are not heard, that their questions are not being answered, right? We see that red flag and we just think that it's going to change. It's time to go. So maybe just reminding your client of some of the things that they shared with you that they didn't like, and just sort of repeating back to them, I know you left that visit and you called me and you were upset, or your questions weren't answered, and then let them know what some offerings are in the area for midwifery care for a different practice.
Absolutely. So after that, it's like, where is a good place for you to deliver? Right? Like people all have different community resources, right? You might be in a place where it's a scarcity of community birth, right? So these are two pictures of what I do. I do hospital birth and community birth, more community birth than hospital. But some people, if you have the access to safe home birth or birth centers in your area, you might have not thought of it because you might think that everyone should deliver at a hospital, but there are, wonderful options in the community, right? And what are some things that the community offers? It offers you the ability to be in a place at home where you're safe for low risk patients to have a baby in a place that smells and feels like them. Some people can't deliver at home. Plain and simple. They might have something high risk that needs to be monitored. They might not have options for home birth or birth center. And having a beautiful hospital birth, look at Rakaya there. That patient looks happy, smiling ear to ear, right? They might be able to have a beautiful birth experience in a hospital with a midwife. I think, Rakaya, the biggest joke we always have is when we go places is, well, girl, I'm not having no more babies. I don't need to see a midwife, right? But I think people don't even realize that midwives deliver at hospitals, right? It's not just community settings. There are thriving practices around the United States that have large midwifery divisions where people are getting home birth like births in a hospital, and they're either medicated or not medicated, but they have a midwife taking wonderful care of them in a setting that they were able to work out in their negotiation process of what they wanted for their birth.
Yes, and one of the things that I'm reminded of in both of these pictures is the relationship and how important that is. So whether you're choosing to give birth at home or in the hospital, it is possible to develop a trusting relationship with your provider. And the births that are on the right, I will remember for a very long time. They were not people that I knew prior to their pregnancies. They weren't a friend of a friend. It wasn't my sister or my cousin, but these are women that I cared for deeply, families that I cared for deeply, that I hold as part of my why as a midwife. So just know that finding a trusting provider is the most important. And then decide what setting, whether that's going to be home, birth center, hospital, knowing that you can make the setting what you need to individualize the birth that you want to have. And it is possible. So don't think that office visits or visits with your provider have to be boring, that they have to feel structured, that they have to feel cold, because I hope that you can see the joy in these pictures, the relationship in these pictures. These are people who were cared for by providers that they trust.
Right. And I think the word I want to throw out there, trust. Just a quick poll. How many of you right now trust your provider? And you don't have to be pregnant. You could be going to primary, well, better yet, do you guys have primary care providers? And do you trust? Forget it. We'll get rid of that question. I'll come back. There'll be another one.
Okay, so nutrition, right? We're in pregnancy now. We're talking about what can we do to help ensure that we are going to have a healthy pregnancy, and as a partner, how can you support that person who is carrying the child? Nutrition is one of the most important ways that you can nurture your body and growing baby during pregnancy, and it's also one of the few things that are within our control. So part of good nutrition is in taking the right supplements and also the things that we put into our body in terms of the food that we eat. One of the things that Heather and I both like to say in terms of nutrition and pregnancy is eat the rainbow. So you want to figure out what fruit and vegetable are in season in the area that you live, and you want to have a diet that is full of fruits and vegetables, also protein, whole grains, legumes or beans, starch, and also fruit. Folic acid supplementation should begin 3 months prior to conceiving. I'm sure many of you have heard of folic acid or folate. The recommended dose is 800 micrograms daily for someone who is pregnant or preparing for pregnancy. And this can be found in a prenatal vitamin or separately. Dark leafy greens are also great sources of folate, so you can start to incorporate that into your diet during pregnancy and before. I often get asked what the best prenatal vitamin is, and my response is the one that you can tolerate and works well with your body. You want to pay attention to things like serving size, meaning to get all of the benefits from that wonderful vitamin, do you have to take 2 pills at a time? Do you have to take it, 3 times a day, or is it dosed once a day? Because that's important. And vitamins are really meant to supplement the nutrients that you get from your diet, which is why having that diet full of lean meat or protein, fruit and veggies, whole grains, calcium, and vitamin C is so important. Protein, we think of probably meat and maybe eggs, which is true, but there are other non-meat sources of protein, things like Greek yogurt, even salmon or some fish, nuts and nut butter, legumes and beans are a great way to get protein. And it is so important for the person who is carrying the pregnancy to get protein. Protein not only helps our tissues develop, but provides amino acids that are helpful for energy during pregnancy. And for that partner who's also going to be engaged in movement and all the things we've talked about, I'm sure you can get some more protein in your diet as well. We already talked about things to avoid in a previous slide. GHA is another supplement that you can take separately or you can find in fatty fish. This is going to help reduce the risk of preterm birth and improve your mood both during pregnancy and postpartum. Support people when your birthing person or your mom is saying that they're craving something, or they, something that the baby wants or needs. You can, stand in solidarity with them and remind them of the importance of what we put into our bodies. And then one other thing I want to talk about before we leave this slide that would be remiss if we didn't discuss is aspirin. How many people have heard about aspirin in terms of pregnancy?
You can use your emotions by raising a hand, or we can't see hands.
Thumbs up. So aspirin, typically you might have heard that you have to avoid taking certain medications during pregnancy because they're not safe. Well, there's been a lot of research to suggest that baby aspirin, so that teeny tiny dose that we recommend for older people, actually can have some benefits during pregnancy. It can prevent or delay the onset of preeclampsia. It can help prevent stillbirth. It can help decrease rates of fetal growth restriction, decrease rates of preterm birth and early pregnancy loss, especially for those who are Black and brown. So one of the things that Heather and I joke about is we think aspirin is going to now be included in prenatal vitamins or pretty soon, because there are so many risk factors for a hypertensive disorder in pregnancy or preeclampsia, just being brown, having it be your first pregnancy. Are you over the age of 35? Everybody is. Do you have a family history? Did your mom have preeclampsia? Do you have a sister who had a small baby and no one knew why the baby was small? These are all indications for aspirin. So we encourage you to do your own research, to speak with your provider, and also support people to remind the person who's carrying the baby about some of the benefits that are found not only in what we eat in terms of our diet, but also in supplements like our vitamins and baby aspirin.
Beautiful. So prepping for the big day begins before conception. When you start thinking about your desires, make sure that your partner is in on the discussion. right? Because it's a pregnancy goes like that, and then all of a sudden the baby's here, and you're like, oh my Lord Jesus, who sent me home with this child? Perfect.
You know, before we keep going, there's a question in the panel related to nutrition I thought maybe we could tackle.
Okay.
So what are your thoughts on natural vitamins? So,
Is that food source?
right, if you mean food source, listen, we are all for vitamins.
Mhm.
Once again, you just need to make sure that you're looking at the ingredients. So when the ingredients are things that we can pronounce, when it says vitamin A and vitamin E and vitamin C and vitamin D, with the appropriate dose, then I think they're great. You want to avoid things that have proprietary blends, energy blends, um, wordings like that, because those things are not FDA regulated. And
Mhm.
honestly, the term natural on a vitamin doesn't do anything for either one of us.
Mhm.
Want to make sure that you can tolerate it. You're not feeling nauseous. You're not vomiting after taking it. And it has that dose of folic acid. I also see here some women have concerns about folic acid because it's synthetic. You can get a diet that's, or have a diet that's rich in folate, so those green leafy vitamins. Folic acid is not a bad guy and maybe gets a bad rap, but there has
Mhm.
been a lot of research to suggest that taking folic acid prior to pregnancy and during early pregnancy can prevent what we call a neural tube defect, which is a
Mhm.
defect of the baby's brain and spine. Those studies did not look at people who took folate, who took these
Mhm.
fancy other folate derivatives. They looked at regular folic acid. So that's what we both recommend for our patients. Obviously, there are certain conditions that maybe put someone more at risk. So you might need more of something. And you can discuss that individually with your provider. But folic acid, as folic acid, is important, and all the other natural versions or derivatives might be helpful, but there's not a lot of research. So um, I don't feel comfortable recommending them because I know the benefit of straight folic acid.
Correct. And I think we also need to, and I apologize for triggers, but food insecurities, right? We live in a country for which we do not all have equal access to what we need to survive. And sometimes in our communities, we don't get the organic foods or we get things that are not as ripe. So I think that supplementation should be used in places for which you're unable to get what you really need to survive, because technically if we were able to eat the rainbow, then we wouldn't need vitamins, right? Because we'd get our food from our land. And I think that until we can have equal access to food, people are going to need prenatal vitamins. Some people don't eat fish. We have vegans. We need to make sure that we're making equitable food choices that can hit all, not just the people that can afford it.
Beautiful.
So looking at here, the thing that I always think so funny is when we're prepping for the birth process, right? People are like, oh my goodness, I need to register for, all the items. But how many onesies does a baby need? 25? And how many things that's going to help the baby sleep? I think we need to get back to the reality that babies are not going to sleep, and we need to prepare ourselves for how we're going to integrate not sleeping for the next year. Um, I love the idea of be calm and enjoy the fact that, postpartum and labor is coming, but we can't do that in a place for which, we're worried about our maternity leave and how many, days do I have left on my PTO before I have to go back to work. I think it's important when we're thinking about prepping for the big day, we need to set up, are we going to have, a postpartum doula or a baby nurse? Is there a dedicated family member that's going to come over and help me? Will people come over and drop off foods? Will someone hold me besides holding the baby, right? Those are the things that you need to start prepping with. Like, are we doing meal prep? I went to go see one of my patients the other day, and she had, 5 of her girlfriends over doing meal prep and washing clothes and setting up stuff and making lists. Those are the things that's going to help be a community. So as a support person to a mom, what are we doing postpartum? Who's going to be here the first week? When does my partner have to go back to work? Don't invite your mom or put her on the list for postpartum support when you have a mom like mine who's too busy to stay home. She'd rather go shopping. So I think it's important that we plan, as we're planning for the pregnancy and eating well and labor, we should also plan with what are we going to do postpartumly. And one of the shout outs that I give here is Be Her Village. As people are making registries and getting those 25 onesies that the baby doesn't need, Be Her Village helps to provide services that this mom birthing person might need in the future. If they want a doula but can't afford it, they can go on Be Her Village. It's a registry and put that they want a doula and they're going to need $1,500, and their family members can go there and put money toward the doula. Or they want a postpartum doula for postpartum period for 2 weeks. They can go on and donate to that. So this person who just had a baby now doesn't have to worry about the financial needs. They have the coverage for what they want. And I think it's important to start planning that early. So after you get the baby and you come home and you and your significant are looking at each other, you're like, oh, this is night number 1. We have meatloaf and Aunt, Catherine's coming over and we're good.
Beautiful. And honestly, these are conversations to have way before that night one, and to have honest and open conversations with your partner, right? If you know that your partner is the type that the head hits the pillow and they're knocked out for 12 hours, then maybe you want to have some conversation about what the nighttime routine is going to look like in your family. Or maybe you're the one who cooks most of the meals and does the grocery shopping and does all the things. Start to have those conversations about who's going to do what postpartum. Because when we don't have these conversations, there can be resentment, there can be maybe feelings of guilt from a partner who doesn't know how to be supportive in the moment, doesn't know what to do. So having these conversations early can decrease some of that, because everyone sort of has an idea. I'm going to pick up the groceries. My mom is going to fold the laundry. Your best friend is going to bring over lunch for a week, all these sorts of things.
And community resources. Does your provider have local resources to help support you for your vision of a medicated or unmedicated birth? That's also in the prep phase. Like, what do you envision your birth to be like? And do you have a plan B? C, D, E, F, G, H, I, J, K, L, M, N, O, P, right? During the pregnancy care, how many people think that going to a lactation consultant for a visit makes sense, right? But if you're planning to breastfeed, you might, when I went for, nursing, right? Like I had to do some pre-work to get to my nursing, and then I got my nursing, and then I had to go to orientation at a job to become a nurse, right? You're going to be a whole person taking care of a whole entire baby that you've never breastfed for. Getting some pre-education is going to help to set you up for success. So I always say, do all the educational things that you can to help decrease your anxiety and increase your success rate. Right? What about going and doing some spinning babies? That's the hottest thing on the market nowadays. There are things that you can do as you're moving and exercising during pregnancy that in turn helps your body get itself aligned for the birth process. Remember, these bodies that we sit all day with, we do things that we're not bending at the knees, we're not lifting weight, our bodies have changed. So staying active, doing things like spinning babies helps our body prepares for the process of birth, and it actually makes it easier. I said to one of my patients the other day, I'd love you to go for a pelvic floor assessment during the antepartum period, like now that you're pregnant. And they looked at me like, why? And I said, because it'll help us to figure out now during pregnancy if there's any hot spots down in your pelvic floor that you might need to concentrate on so that you can let go, so that you're able to ease your baby through without any issues. Having that during the planning phase, that pregnancy phase, will help for the delivery phase to make it a little bit easier. And remember, massage and chiropractic care, don't think you can't do those during pregnancy. As partners and support people, we want to encourage our moms to do that, because taking moments to be mindful helps with pain reduction and overall makes a better mommy and birthing person.
Beautiful. And I have just one plug for Spinning Babies. In addition to what Heather mentioned, Spinning Babies has a lot of maneuvers and exercises where you need an extra person. And this is a perfect time for your partner, best friend, support person to be with you. Meaning maybe for this sideline position, you need to have someone else who's going to help with the massage, or you're going to do a forward leaning inversion and you need someone to support you. These are great ways for your partner to be present, to be connected to the pregnancy, which is very different for a partner than the person who's carrying the child. And also familiarize yourself with the touch and what you think you might want during labor and not. you want to get comfortable with that before someone is in the middle of contractions, right? So because you have practiced these maneuvers, because you have done some massage, because you have supported your partner, you'll have an idea in labor of maybe what they would like and, don't like. And it won't be that's the first time you've ever tried a back massage in labor. That's the first time you've ever tried to massage a hip or those sorts of things. So another plug for spinning babies and the idea of, massage and incorporating those things during pregnancy and during the labor.
Just hitting the chat before we jump into this. Be Her Village, there's a link, and add postpartum doulas in the message, right? Yep, got it. And Chelsea Love, postpartum planning should start with the positive test. Yes. And that you go into a midwife. Absolutely. So we wanted to make a plug here because every day someone mistakenly after 25 years still thinks I'm a doula, but I was a doula before I'm a midwife. But today I am a midwife. And I think it's important that support people understand the differences so that they're like, I already hired a midwife. Why do I need a doula? I tell people the doula is the epidural. You need the epidural from at home, right? So you need to get yourself a doula. Absolutely. And I think people should know that doulas make the job of the provider so much easier. The doula should be getting all the money because a great doula is worth her weight in a person that goes into great labor and the baby somehow slips out before anybody got in the room. It's like, oh, I don't know how that happened. So a midwife provides prenatal care and they track the health and do ordering of tests during the pregnancy. What does a doula do, Rakaya?
A doula might be there to help develop a birth plan. I like to call it birth wishes, birth preferences. They're there
Absolutely.
to provide some education and to help plan for the logistics of labor. How long do you want to labor at home? Where do you plan on birthing? What is your plan for the postpartum period?
Right. I, as the midwife, I want to monitor that you're doing well, that your baby's doing well, that I'm ordering the tests and interpreting the results so that mom and baby are healthy, right? I want to make sure that you are going for your education. I want to make sure that you're going for the visits and sonograms and things that you're doing. I want to collaborate with physicians in my community that's going to give you better outcomes, especially in our brown and black women, right? Like I might want to refer you to a cardiologist because I want to make sure everything's going well with you not having hypertension or cardiac disease. I might want to send you to, a neurologist because you're having headaches that doesn't seem like preeclampsia. So those are the things that your provider is doing to help coordinate your care.
And the doula can be there to support you during pregnancy and during the labor, to do some hands-on techniques to help relieve pain. Listen, Heather and I love to do a little hip squeeze and to do some spinning babies, but sometimes we have to do that other side on the midwife column, and the doula is right there to do the positions to help support you, to help advocate for what you want during your labor and your birth and during your pregnancy as well. We had Ashley talk about her client who wants to switch at 26 weeks. As a doula, she's helping to advocate for her patient. They can give postpartum care. They can support the partner, meaning maybe that hip squeeze is working well with the doula, and then maybe the doula can call the partner over and try to do a little switcho changeo, and to provide some emotional support postpartum and to maybe assist with some newborn care in the postpartum period.
And I'm going to say this, and I will stand on my soapbox and 20 Bibles. Every birthing person, every mommy, every person who is birthing a child needs a doula. Absolutely, without any disregard. I don't care if I step on a physician's foot. I don't care if I step on a midwife foot. Every birthing mommy person needs a doula. You need your own support person that's going to be your village that knows that code word. I know my patient's code word. When they say pineapple, that means they're down for business. Don't play with me, Heather. But the doula knows that code word also. And I think it's important that as a support person, and you know what, Rakai, we didn't say this. If you're like, oh, my partner's going to support me, your partner's going to support you this much. A doula is going to support you down the road, right? Like as soon as they say, oh, my husband loves me and he's going to
This is what we
support
do.
me,
We do this
I'm
a lot.
like, who's supporting who now? I'm getting it. So the husband, I say, or the partner needs the doula. You don't need the doula. Your significant needs the doula. So we need doulas for everyone. You get a doula, you get a doula, you get a doula. Perfect.
Yes.
Check in the chat. Chat looks good. So my question to all of you as we're moving through the phases, right? We've just finished appetizers. We finished the salad. Now we're moving into the main course. My question is, when is a good time to go to the hospital? Please use the chat. Do 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 do. Do, 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 do. They don't want to talk to us. Okay, so you bleeding. Okay, if you're having some bleeding, absolutely. And once again, bleeding versus bloody show. What is your approximation to the hospital, right? Like that might mean something. You might have had a conversation and they told you about the 511 or the 411. They might have told you once your water breaks, you should go, even if you're not having contraction. I think the best bet is having a conversation with your healthcare provider to find out what their parameters are. You know, there are some healthcare providers, and I'm once again empowering the significant others to ask this question, that providers who want people as soon as your toe is itchy, you might not even be having a contraction for you to go to the hospital. And there's other providers that want you to get to the hospital or have the midwife come to the home when they're cooking with grease. That is a conscious, safe conversation that you should have with your provider. And if your provider says, as soon as you start having contractions, come to the hospital, you should be asking them, what is their C-section rate? Because if you've had one contraction every 4 hours, you're going to have interventions given to you that might warrant a question and an answer. So I think it's important to question the provider to find out what is their comfort level so that you and the doula and your whole support team know. And then I think regardless of your mother, your aunt, your friend, your neighbor, when they were instructed to go to the hospital was their story, not your story. So you build up a plan that works best for you, not for your community. All right, so we're moving into dinner, which is the labor part. I love this. Here we go. So labor, right? This is the doing phase. I love this phase. Practice makes perfect. How about practice makes prepared? So just like Rakaya was talking about spinning baby stuff and hip squeezes, you need to start doing things that's during your pregnancy that's going to help your labor process. People, when I have my patients at home and I do a walkthrough with them, I basically say in that early part of labor, if it's not taking away your breath, it's not causing you to be distracted, then you're still in early labor and you can keep on going. The key at home is distraction. The key at home is not bringing too much people and their energies into your space that's going to change up your juju, change up your atmosphere. Rakaya, what about hospitals? What are some things that they can do there?
So similar to what you said, and I think it maybe is easier, though I don't like to use the word easy related to labor at all, at home to control your environment. That's something you want to consider in the hospital as well. We know that labor can be affected by how we feel, by our emotions, by the safety or the lack of safety that we feel. So it's so important to make the space your own. Hospitals may have access to birthing balls, to being able to labor in a bathroom, to showers, to you dimming the lights, you having your flameless candles and aromatherapy. It's important that you customize the space to make it your own, a space that brings peace and comfort, excuse me, and a space where you feel safe. Because when we don't feel safe, it affects our nervous system. And when our nervous system gets affected, it affects our labor. And partners, this is a plug for you. You can be so incredibly important in bringing that birthing person back into their body and ensuring that they feel safe, right? So if you notice every time the door opens, you see your partner all of a sudden clench or raise their shoulders, or, you can be there to remind them, to whisper, to let them know that everything is okay, to make them feel safe. Because once again, our environment is going to affect the way that we are able to birth. And partners, you have a big role in this.
And doulas also play a wonderful role in this because sometimes people don't want to be the bad person, right? Like the mother and the aunt's here, but no one really wanted the mother and the aunt here. The doula can, with the permission of the family, be like, you know what, this is a great time to go get a coffee. Or is it possible for you? I have no problem. I'll kick somebody out of the room in a second. Everybody knows me. I'm good. But I think it's important that we incorporate a nice, safe team that people can advocate for the mom, the birthing person, in a way that's secure and that can help the labor process move forward. So I have a question for you. Is this the time that I should be bringing up the birth plan when the baby is coming out? Chat, please.
And one of the things, as we're waiting for you to respond, what we find is that the more trusting relationship you have with your provider, the less items you have on a birth plan or that you even have a birth plan, because you feel heard every time you're in that office. Your questions get answered. You know that your wishes will be respected. I also love birth wishes and preferences rather than a birth plan, right? Because plan makes it sound like it's set in stone, and a birth wish or a preference makes it sound like something that is fluid, that can be flexible, that can be adjusted,
Yeah.
if need be.
It's so strange that when I worked in a hospital setting for so many years, people came in with their birth wishes. And what I found when I opened my own concierge practice, every time we met and we talked and we cracked jokes and spoke about what they wanted in their birth and their vision, I already had it planted in my head. So it was weird to me that none of my patients had birth wishes. We talked about it all the time. And I realized that birth plans in a hospital is basically the directionality that we want our providers to go in, because you might be in a place where there's a large practice and you might have been with Rakaya and she knows all your intricacies. She knows what you want, but maybe that the next, when you came in for labor, she wasn't there. So your birth wishes now needed to be communicated to another provider so they too can be in sync with you. And it's not a bad thing. Birth wishes are what you want, and the communication of those wishes should be thought of as a positive. So if you have a doula or a patient where you say, I have birth wishes, and somebody gives you shoulder or face, just say, I'm trying to be communicative or communicate with my providers so that we're all on the same page, knowing that mommy and baby is safe and that these are some of the things that I want. All right, so we're moving into the postpartum era, into the fourth trimester. And it's important to remember that this, phase, this recovery phase, starts from birth and ends at 1 year. Okay, it's very important.
Um, and I think we've spoken about this already, but it's so important to plan for the postpartum period. We have people that plan for pregnancy, that have their birth wishes and preferences, right? They know the car seat they want to buy, they know the breast pump they're going to use, their provider, and then boom, we get to this postpartum period where the family is supposed to be recovering and we haven't planned. So I believe on previous slides, we've given you lots of information on how you can plan partners, your role, Be Her Village, having a registry, communicating your needs, because it takes a village, right, to raise that baby and to support that mom. You need your community. And in our country, we don't really do a great job of supporting families during the postpartum time. We need our village. And unfortunately, that might mean that we have to pay for the village now in terms of that postpartum doula, that person who's going to support you and your baby overnight, meal planning, someone to maybe clean your house, things that back in the day your church community or your family would do. Now maybe you have to step outside, and that's okay. We want to make sure that you're planning for it.
Absolutely. And I always like the reinforcing and supporting, right? Like, what are some postpartum healing meals? Like, I'm West Indian. I believe soup and anything that has, bone broth or nutrients where things are boiling and you can drink the water and stuff. We need to plan for that, right? Like, that shouldn't be done like I'm ordering. And there's nothing wrong with Chick-fil-A. I do believe there's a little drugs in there because I'm addicted to the chicken, but that's a side note. I believe that this is where we take back to our culture of what are the foods when people are sick that people brought in Pyrex dishes. The younger generation has no idea what a Pyrex dish is. There used to be casserole communities. No one even knows what a casserole is. But what are the foods that your culture brought in that helped with the sick people to make them better? That's what they're supposed to be doing during the postpartum period, right? I remember one of my midwifery students, she was like, looked at me sideways because I didn't know she's on here today. 5 days in the bed, right? People spend 1 day in the bed, the next day they're at Target, and then the third day they're calling and telling that they're bleeding, right? And I'm like, how did I just see you at Target? Didn't you just have a baby? You're supposed to reinforce support people 5 days in the bed. That means your feet are under the covers. You're like in the bed, almost like someone zipped you into a bag. Then after that, you have 5 days on your bed. That means you're not under the covers. You're on your bed. You might have a toe on the floor. You might get up and look out the window, but you have to get back to the bed, right? Tag you're it. And then 5 days near your bed, meaning that you might take 10 or 15 or an hour away from the bed to go do something, but within that time, there's a little rope pulling you back into the bed because you need to rest. And what we find is, what I found over the years is I call it a triangle. At the top is, that eating and hydration, right? Over here is that rest, and over here is the support. If any of those doesn't close up, it increases the risk for mental health, postpartum blues, postpartum depression, psychosis, and maybe anxiety. We need to support people by it's okay to lay down. That's what that pre-planning is. Who's going to be there postpartum to allow me to surrender, right? It's it's important. I always say this now. When people say I got it, they don't expect that you got it. They don't have any faith in you. So we want our postpartum moms and birthing people to be supported from the floor up so that they know that they don't have to get up and do because somebody has their back. And then fourth trimester support groups. This is popping up all over the United States. We need to have groups where similar people with similar situations, postpartum and baby, can come together and realize, yes, my baby's crying. Your baby's crying. My baby's crying. That's normal. That's normal. I don't know. But it's nice to be with like-minded people, because if they're having it and you're having it, then it's normal. Because if you as a provider or you as a significant saying that this is normal for when the breast milk comes in, the emotion comes in, they're looking at you like, no, it isn't. But they go somewhere and someone says, last night my breast milk came in, I was crying for 4 hours. You too, I had the same thing. It helps them to know that they are normal, and it helps them to transition into this postpartum fourth trimester much easier.
And we want to spend a moment talking about mental health. We understand that we're including it in this postpartum section or the act, but mental health needs to be discussed outside of the postpartum period, or rather before. And also it needs to be revisited, because someone might feel one way preconception, a different way in early pregnancy, and a different way postpartum. Your mood might change, and that's okay. There are a wide range of emotions that are normal in pregnancy and the postpartum period. There are hormonal things that are happening, there's bleeding, there's lactation, and sometimes these periods can be stressful. We'll keep it real, and also overwhelming. But it's important to discuss how you're feeling with your provider, to have that safe space and that trust. It's also important to note that having a pre-existing mood disorder does increase your risk of having a mood disorder during pregnancy and postpartum. So you want to be honest with your history with your provider. And this information is for partners as well, not to just support the person who has just given birth or the pregnant person, but also support for you. So one of the stats that is very surprising to me, but I guess not, is that 1 in 10 dads will experience a perinatal mental health disorder. So you want to make sure that the support is going both ways, right? Not just to the birthing person, but also to supporting that partner, and that the community and the village supports that person as well.
Nice. Just going to the chat, we have 2 more slides. The new breed, we're not growing up our new generation to know their community. We're not growing up our new generation to be non-disposable. My kids are, because they come from scarcity. Even though they don't, I'm teaching them to come from scarcity. We need to instill in our community how we can do things to support the next person. We were not meant as a race to be alone. So that's what I mean by that. With regards to the pyramid, I made this up years ago, because when you see people in the community, when you get to know the people that surround you in your church community, your supermarket, the first part over here is eating and drinking. The other part is, so I make the triangle. So you have eating and drinking, you have adequate rest, and over here is support. So if you have people supporting you, when you get support, you can rest and eat, put it all together. You're all together, and you get through the postpartum era, the period. Sorry, got sidetracked. So I have a question for you. It takes a community to support a new mother birthing person and family. What else can we do to help support them? Please throw something in the chat. If you could think of one thing to close this segment out, what would be something that you would do to help support someone during the pre-pregnancy, the pregnancy, and the postpartum period to help them be successful? Listen and be present. Absolutely. Thank you, Toby. Thank you, Dominique. Connect with community resources.
Yeah, the whole village, not just your immediate family, friends and family. Absolutely. Some people don't have family members that live close by, or maybe it's one sibling. We can't have the whole postpartum period, resting on the arms of an auntie. We want to have that entire community.
Absolutely. And to bring this home, Rakaya, you want me to go? You want to go? You do this so well.
Talk. So we hope that we have given you some information, both as a person who is pregnant, but also the supportive person in terms of things that you can do. So preconception, optimal weight and nutrition. You want to keep moving and exercise right along with that birthing person. In pregnancy and labor, you want to know your options. You want to educate yourself and choose the right provider so you can have that trusting relationship. And fourth trimester, you want to enlist your support team, focus on RENEST and renewing and that triangle.
Yep. And you want to do laundry and snacks and meal trains and declutter. Listen, declutter might cause you to get stabbed. I'm not, listen, when you go to people's house and pick up a bill, that bill's been there for a reason. It's covered in a stain. I'm not decluttering. And sibling support. Absolutely, Dominique. And I thank you all. I am hashtag One Love Midwifery. By all means, please follow me on Instagram. And Stony Brook Midwives, they are awesome. Hashtag Stony Brook Midwives on Instagram. It takes a village, and you guys were here to support us today, and that was great. Thank you.
Thank you so much, Dr. Finlander Hines. Thank you so much. I've been calling you
Ricky. It's okay, Rakaya. Long
Hiya.
and I had written in my notes like Zakaya, and I still said it's but thank you. This was wonderful. We will send the recording to everyone. We'll also include links to our brilliant speakers. Our next workshop, we've got folks in the waiting room. We're going to talk to dads, but we so appreciate your time and your support. And as usual, I have a whole book of notes like, oh my gosh, we need to do this. So we hope to bring you back when you have time. Thank you, ladies.
Yes.
Have a good evening.
Thank you.
Thank you,
Bye, everyone. Come back next year, folks.
Yes, bye.